I'd like to welcome Minister Grealish here this morning. You're very welcome. And we now move to the first commencement in the name of Senator Tully.
Before I start, can I just ask why there's no Minister for Health here? And I wasn't notified that there wouldn't be. Now, Minister Grealish, nothing against you. You're here to represent whatever minister there is. But it's very disappointing. It's a really important issue on health and no Minister for Health. You know, so, like, Minister is not going to be able to give me a comprehensive answer because it's going to be a pre-prepared statement.
Okay.
So it's very disappointing.
All I can do, Senator Tully, is give the commitment to bring it back to the Department of Health and to the Minister and to ask the question. And obviously, Minister Grealish will do his best to...
I know, and it's nothing against Mr.
Yes, and I understand that, but I'll give you that commitment that we will contact the Department and the Minister's office. Is that okay?
Yes, thank you.
Thank you.
Okay, right, I want to raise a couple of cases in relation to Cavan General Hospital. So Aaron is a 12-year-old boy and he was admitted to Cavan General Hospital on Monday the 27th of April in severe pain. An ultrasound was carried out and it was determined that he had appendicitis and that he would have keyhole surgery on the Tuesday. On Tuesday morning at 3 a.m. he was in extreme pain. A nurse constantly called for a doctor, no doctor came. On Tuesday morning, he was prepped for an operation to go to theatre. He spent all day waiting while he was fasting and had no water either, couldn't drink water, and he wasn't brought to theatre until 10:20 p.m. that night. So the whole day, a 12-year-old without food, without water and in pain. He had the operation, his parents told him it went fine. On Wednesday, though, afternoon, he was very unwell, and it was only then that a senior consultant admitted that the appendix had actually ruptured and the operation had been much more messy than should have been and that they admitted to. And like, they were giving him antibiotics, so his parents were really concerned that he would contract sepsis. He was really, really unwell. He remained very unwell and in hospital for a few days. He was been given antibiotics and a huge cocktail of antibiotics. And then it was deemed that the antibiotics were actually having an adverse effect on his liver. So then he was taken off those and he was discharged on Monday, even though there was still an infection in his body. He actually had to be rushed back to hospital on Tuesday by ambulance and to Temple Street on Wednesday, where he had surgery on the Friday because there were complications with his bowel. There was an obstruction, which we don't know the reasons for, but we assume it's something to do with the initial keyhole surgery and because it was so much more messy than it should have been. He's home now, but he's still very unwell and his parents are still very concerned that they're not at the end yet. Oren is a 20-year-old who was admitted in September, 16th of September last, to hospital, again extremely unwell. He spent all night on the trolley in A&E, no scans, nobody seeing to him. On the next day, on the 17th, he got an MRI scan and ultrasound and they said yes, he had appendicitis, he needed keyhole surgery and an operation was performed at 1:30. Again, he was very unwell and was only then, a couple of days later, that it was admitted that the appendix had ruptured in this case too. He remained very unwell and on the Friday, the parents were really worried about him, but there was no doctor to be seen until Monday evening. So he spent the whole weekend without a doctor. Again, in both cases, actually, I meant to say there was a drain put in and there was very putrid discharge in this drain from both of them. He ended up, Oren had to have another operation on Tuesday. Was in ICU for a number of days and back to a ward. He was discharged on the following Monday, but had to be readmitted on the Thursday, again, still very unwell, and eventually was transferred to Beaumont a week later. So he spent a week in Cavan General, just being managed, and then a week went to Beaumont, and he spent 8 days in Beaumont on a cocktail of antibiotics, and they thought that they had got him out of order. He ended up back in Beaumont in November again, and it turns out there was a bowel obstruction due to adhesions from the surgery in Cavan. That young man ended up losing out on a semester in college, and he has still another operation to go to relieve all of the issues as a result of the surgery. So this is happening too often. There's been a number of other cases where people have been left too long and the appendix have ruptured as well. And it's just, we need to see, some inquiries made into this and a proper investigation of what's going on. Is it a case of staff under-resourcing, or is it a case of incompetence by certain members of staff, or a combination of both? We really need the Minister of Health to look into this. Thank you.
And I want to thank you for raising that issue. As you rightly said, I'm taking this on behalf of Minister Jennifer Carroll McNeill, one of the two issues that you raised. Hopefully that the two young lads will get back to full health, but I will make sure that the Minister gets a transcript of what you raised here, and I will ask her to reply directly back to you on them two issues that you raised. And look, nobody wants to hear of situations like that, but at the end of the day, hopefully that they will be okay. But I'll be reading the script that I've been given by the department to deliver. I would like to thank the Senator for raising this issue, which I'm taking on behalf of the Minister for Health, Jennifer Carroll McNeil TD. Cavan Monaghan General Hospital is part of the Dublin North East hospital group. The two sites are 46 kilometres apart and operate as a single hospital with an integrated managerial and clinical governance system, care pathways and support functions. The hospital currently provides services to the population of both counties and surrounding areas. All acute inpatient services are based in Cavan General Hospital. Both hospital sites provide extensive outpatient, theatre and day services. Also, Cavan General Hospital provides a 24-hour emergency care. The HSE has advised that Cavan General Hospital operates in line with national healthcare standards and established clinical governance frameworks. Both the surgical and emergency departments follow protocols with care delivery guided by national policies, clinical guidance and regular oversight mechanism. The hospital is subject to ongoing monitoring, audit and quality assurance processes which are designed to maintain high standards of safety and effectiveness. As part of the ongoing quality assurance process, HIQA inspected Cavan Monaghan General Hospital in 2024. The ED and 4 ward areas were assessed during this unannounced inspection. The findings of this inspection were positive, with 10 of 11 standards found to be compliant or substantially compliant. Senator, in Cavan ED, trolley numbers have decreased by 20% in the last year. In the same period, waiting times have also reduced. It is important to note these improvements occurred in the context of increased emergency department attendances. Additionally, the waiting list for inpatient and day cases procedures in Cavan has reduced by 15% compared with April of last year. Any concerns regarding care or procedures are addressed through established review systems, including incident reporting and clinical audit. There has been a significant investment in Cavan Monaghan General Hospital in recent years. The combined budget for the hospitals have increased by 59% from 115 million in 2020 to 183 million in 2026. Staffing has increased by 325. That's an increase of 28%. Bed numbers have increased by 11, a 4.8% increase since 2020. According to the acute inpatient hospital bed expansion plan, which aims to deliver 4,367 acute hospital inpatient beds by 2031, a total of 97 beds will be delivered at Cavan Monaghan General Hospital by 2028. This includes 23 beds delivered between 2021 and 2024 and 74 beds between 2025 and 2028. The hospital delivers safe and timely access to our patients and community and performs highly in national and unscheduled care and ED key performance indicators. A new purpose-built ED and additional bed capacity has received planning permission and have started to progress through the development stages since 2025. The provision of a new extension block to the existing hospital front entrance, including new oncology unit and an upgrade of pharmacy services, are currently at design stage. Let's go here, look.
Minister. Minister, just to say, like I and the people of Cavan are delighted that we have a public hospital or a general hospital in our county, but we want a hospital that we can, trust and know that when somebody goes in there for whatever reason, that they're going to be cared for in a timely fashion. And I've had wonderful experiences in the hospital. There are wonderful staff in there, but they are overworked. And I know that the hospital manager said, "Oh, we operate to safe staffing levels and so forth." And your statement is referring to the same. But that's not the feeling that both these individuals and their families and many others have when they go into the hospital. They see staff rushed off their feet, not having time, to see the patients properly. And it's not fair. It's putting pressure on them, and that's when mistakes are made. and in this case, possibly these were mistakes. As I said, we need answers to what happened here, but we also need to ensure that it doesn't continue to happen. And as I said, 4 cases that I'm aware of in the last year. There was another young lad in February, left too long, his appendix ruptured as well. Thankfully, he didn't seem to have any bowel complications afterwards. But another young woman told me that her colon, was perforated when she was getting her appendix removed. So, I mean, there just are complications there, and I do believe it's a staff issue, and that we just need more staff to ensure that that patients are seen to. And these families, they were traumatised. I mean, one mother that reached out to me said she nearly couldn't speak about this for months afterwards because they were so traumatised by what they went through, and they were so worried about their son at the time. So I would appreciate if it's brought back to the Minister and we get a comprehensive reply to the specific issues. Thank you.
I want to assure the Senator that I will bring this issue back to the Minister for Health, and I will actually hand it to her personally when I meet with her, and I will ask to revert back to you. Nobody wants to hear of cases like that, but at the end of the day, the staff in the health service, you have to acknowledge it, and I think everybody in this House, they do tremendous work. Some places they are under pressure, we all know that. Recruitment is a problem as well, but look at, hopefully that they will be able to get on top of these issues, and I will ask the Minister to revert back to you. I want to thank the Senator again for raising this matter, and I wish to reiterate that Cavan Monaghan General Hospital operates in line with the national healthcare standards and established clinical governance frameworks. Both the surgical and emergency departments follow protocols with care delivery guided by national policies, clinical guidance and regular oversight mechanisms. Patient care is supported by multidisciplinary teams, ensuring that treatment decisions are made collaboratively and in accordance with best practice. The hospital is subject to ongoing monitoring, audit and quality assurance processes which are designed to maintain high standards of safety and effectiveness. Any concerns regarding care or procedures addressed to the established review system, including incident reporting and clinical audit. In this context, it is important to emphasise that the hospital's positive inspection report following its last TICWA inspection. In the last year, there have been also there have also been improvements in waiting times for both emergency patients and those awaiting inpatient procedures. I would like to emphasise that the Government is committed to ongoing investments and service enhancements in the region. Substantial improvements have been put in place, including an uplift in bed numbers, staffing and increased budget. Additionally, a new purpose-built ED and oncology unit are progressing.